I'm presenting an unpublished paper, what I'm writing together with my colleague, Dr. Sophie Meyer. She was in Madrid last year, so maybe some of you met her. And we are welcoming comments and more in-depth research ideas on the topic. So I'm looking forward to your questions and also afterwards. I'm jumping on that topic. I think it's all over in the media right now, the 4-day work week. So there are some trial studies in Iceland, in Great Britain, in Spain, and also like in some others, like in Germany, it will start, I think, in the middle of next year, some trial studies. And yeah, so everyone is talking about, do we need a working time reduction? Should I just work 4 days a week? So overall, I want to start, what are the reasons for working time changes on employees' view? So if we're thinking about reduction, there is one main reason: it is more time needed for recovery because of any health issues. The second one is we just need the time for other tasks. So maybe family and child care, but also further trainings. So that, you want to learn something new about your occupation or even a new occupation. And the third reason, or the third dimension is the time should not be invested in work. Maybe you just need more free time, more time to chill, more time for holidays. But on the other side, it can also be that there is less workload from the employees. So our first overall question is, are changes in working time related to employee well-being? And we can have a look on it from two sides. So if we have a look into the research, we can see, or we have a lot of research taking long working hours together with well-being issues. So overall, we can see that long working hours are related to poor mental health, that they are also associated with cardiovascular diseases, diabetes, or poor physical and mental health. In fact, there is one study from Great Britain, or based on UK data, who say, we don't know if there's an ideal number of working hours just focusing on well-being. So they build up some groups and they say, oh, okay, we just have to work 8 hours now. Unfortunately not, I think. But if we focus on this study, it might be driven by unobserved heterogeneity or reserved causality, because working time, it's not that an easy thing to analyze and focus on. But we have some studies taking the other side of working time changes, reduction, who analyze policy reform. So we have this exogenous shocks. So there was one, for example, in South Korea, where they put the contractual working time from 44 hours to 40 hours, and one in France and Portugal some years back from 39 to 35 hours. So there we had like an exogenous shocks for working time reduction. And what we can see over there is, for example, for South Korea, that the unhealthy behavior such as smoking or drinking decreased, and because there was more time, an increasing in regular exercising. Also, we saw like an increasing in overall life satisfaction among employees, and a decreasing in working hours improved also job and leisure satisfaction for France and Portugal. Then heterogeneity effects are also very interesting, especially from my sociology perspective on it. So women overall benefit more than men, and also blue-collar workers benefit more than white-collar workers. So if you have more physical job demands, it's better if you spend less time at work. And also, from the working time perspective, we see some other factors that might be interesting. So if individuals worked over hours after the reduction, they're even noticeably happier. And also the satisfaction with working time and working conditions were more important than the earning satisfaction. In Germany, we not had such exogenous shock, but Sigan Rehm and Wunder did a study based on the socioeconomic panel. So from 1985 onwards till 2014, there were some small changes in the collective agreements for the public sector. So we're talking small changes, contractual working hours between 1 to 2 hour changes from like 40 to 41, 38 to 40, 40 back to 39, something like that. And in the study, we can see that every time if in the public sector was increasing in some federal states, it impacts health negatively. And also they discovered some heterogeneous effects for gender, so women also benefit more by decreasing, and for children. And what they pointed out was that it really remains unclear which role flexible working time arrangements played. So why is it important to take that into account? I think you heard already some points, because we know that if you are working in some flexible working arrangements, it's positively with job and labor satisfaction. It also associated with better physical health, and also planning and schedule autonomy is important in context of a work-home or work-family context. So coming to our paper objectives, the first question is still there because we have not so much research for Germany right now, and the research we know it's only focused on public sector. So are changes in working time related to employer well-being? And as well, we focus on heterogeneous effects across the different groups. And as working time researchers, we also want to see if we put control and autonomy of flexible working time, so not job control, what we already had, it's just focusing on working time over here. Which role does it play? As data, we use our BAuA working time survey. It's a binary survey started in 2015. We restrict our subsample now to dependent employees aged between 15 and 65. And they needed to work at least full-time at their first point of observation. So all the results I present you right now, they started in a full-time job. And it's paid, and they needed to be at least 2 times in the survey because of our methods. We used pooled OLS and fixed effects regressions, also to accounting for time, constant, unobserved heterogeneity. Just quickly go through our operationalization. So we focus on actual working hours. That's important because if we're looking on a full-time sample, it's much easier to reduce the actual working hours than the contractual. It's like in some jobs, it's not possible to switch from full-time to part-time, back to full-time, back to part-time. But we did it for robustness also with contractual working hours. Our well-being outcomes, we use 3 different ones: self-reported health, psychosomatic complaints, where we built an SAM score, including like fatigue, stomach complaints, physical exhaustion, and emotional exhaustion as examples, and we refer to work-life balance. For our indicators of autonomy and control, we took another research from my side, and there we made a principal component analysis with 2 components. And the first one is like control over working day. It includes like the influence, if you have fixed beginning or endings, if you work from home, or if you have flexi time. And the second one is a control over taking time off. I think it's quite well known for work time control, influence on taking hours off, taking breaks, or taking days off. We also, for the pooled OLS, we needed some control variables. We took like sex, age, education, if there are children's, and the main occupational sector. So overall, the descriptive evidence, we can see there is a reduction over all years or all waves of the BAuA working time survey. So men's in mean, it's around about 1 hour. For women, it's a little bit more than 1 hour. If we look at our OLS regressions and our fixed effects regressions, we can see, for example, if we look on a work-life balance, that 10 additional working hours, this is just a mathematic thing behind why it's 10, leads to 0.23 on our OLS regression and 0.2 on fixed effects, poor work-life balance. So we can see, okay, if we are increasing working hours, we have less well-being. And we can see it also for the 2 other factors. If we look at our heterogeneity across groups, we see the same direction of the estimators as I just showed you, and they're really, really close to the overall model. This is like not what they find in the other studies, but we think it's because we did this full-time sample that we can mainly say, okay, it's a full-time effect and not a gender difference over here. And if you have children or if the employees have children, it's also suggest a less pronounced relationship between more working time and all indicators. Okay, at last, the interesting thing, what happens to the flexible working arrangements. Here I'm showing a margin plot. I don't know if you're all familiar, but what you can see over here, we did 3 modules, and the last modules included all with interaction terms. Like it's still over there, if you're increasing working time, you have less well-being, but the control over working day and the control over taking time off buffers this. And even it is, for example, for self-rated health, we can see that it buffers more than the increasing estimator is. So at last, some limitations, like we have little variation because we can just refer to 4 waves now. The 5th wave is coming end of this year. I think we really can see a healthy worker effect, what is often a problem in panel studies, because people who can perform more, especially in our full-time sample, they can work more. And our approach does not account time variant unobserved heterogeneity. At the moment, we have no idea how we can fix that, so I'm looking forward. Yeah. Last, what is your take-home message? For all well-being indicators, the results indicate a negative association with increasing working hours, so we all need to work less. Thank you.